In this video, the Department of Physical Therapy at UMES, the University of Maryland Eastern Shore, will be presenting on myotonic dystrophy. Thank you for joining us. We'll be talking about what myotonic dystrophy is and how it affects people, and about how PTs and PTAs can help. Myotonic dystrophy is one of the many forms of muscular dystrophy. We'll focus on type 1 myotonic dystrophy, known as DM1, and show you how to use some key signs and symptoms to recognize potential DM1 and get the ball rolling towards diagnosis and treatment. Without us, this process typically takes 7 years, but with this video and some other resources, you can be a big part of getting the right help faster. Myotonic dystrophy, also known as DM, is a progressive multisystem genetic disorder characterized by muscle weakness, myotonia, and early cataracts. DM can also impact other body systems, including the cardiac, endocrine, gastrointestinal, and pulmonary systems. DM has great variation in its presentation. It has two major forms, DM1 and DM2. Diagnostic delay is common in DM. The average time from symptom onset to correct diagnosis is 14 years for DM2 and 7 years for DM1. In this video, we will be focusing on how PTs and PTAs can help decrease the very long diagnostic delay in myotonic dystrophy and how you can make a huge difference in these individuals' lives. Let's get started. You have a special set of skills to do this, and after this video, you should be able to use those skills to recognize common signs and symptoms of DM1. Just as there are key signs and symptoms of other commonly seen conditions, DM1 also has key features that we want all of you to be able to notice in a patient. We're going to start by checking on one part of those skills by watching the following YouTube videos. The links for the full videos are provided at the end of the presentation. Think about what conditions come to mind. What condition comes to mind when you look at this video? What if we add another video to it? Can you recognize the symptoms? After pill rolling and ambulation, does seeing multiple symptoms give you more confidence? If you said Parkinson's disease, you are correct. PTs and PTAs are really good at recognizing clusters of symptoms of an associated condition. Now, just as the other condition had key characteristics, let's look to see what DM1's key signs and symptoms are. Here's another video. Note what is atypical. Both hands grip, but one can't release their grip. This is called hand grip myotonia. The myotonia is a key feature of myotonic dystrophy. If you can see this, you can help reduce a huge diagnostic delay for DM1. Hand grip myotonia doesn't always look the same. Watch these people try to grip and try to release. You can also see the myotonia with percussion at the CMC. And also at the finger extensors. Another sign of DM1 is facial muscle weakness, which can include eyelid ptosis or pathological drooping of the eyelid. Facial weakness can also show as eyelid ptosis or is paired with trouble chewing or swallowing. We often see eyelid ptosis unilaterally as above, which can be easier to recognize, although in DM it typically shows bilaterally as below. Distal muscle weakness may also occur in individuals with DM1. Some features of DM are relatively easy to see. Others are more hidden, like fatigue or EDS. It can be hard to distinguish and can be mistaken for other conditions or even laziness. It can be impossible to get through even half a day of work or school. It often requires a person to choose which tasks or activities to spend their energy on, either at whole body level or more targeted, such as with a hand. For example, if I cut my own meat at dinner, I won't be able to type for my homework later. These 4 listed signs and symptoms are definitely in the physical therapy wheelhouse. Let's look at a list of experts have together to help lead to a diagnosis. Look at this overlap. This is a list from the Myotonic Dystrophy Foundation. The diagnosis of DM1 should be suspected in any patient presenting with at least 3 of the following. We already saw eyelid ptosis and myotonia, and we all know how to see distal weakness. In fact, it's the distal weakness that would likely bring these patients to us before their true diagnosis. But when you see foot drop, there may be more to consider. As for polychromatic cataracts, we probably would have to ask the patient. In addition to the 3 previously discussed symptoms, the Myotonic Dystrophy Foundation also says the diagnosis of DM1 should be suspected in any patient presenting with any one of the above or a family history of these symptoms, as well as those listed below. These are all important to recognize, especially first-degree heart block and prolonged recovery, or respiratory arrest following an anesthetic. Early diagnosis is important for recognition of these signs and symptoms because if left unchecked, can lead to unnecessary risk with medical procedures and even sudden death. Having anesthesia, such as for surgery or dental procedure, is especially risky for people with DM1. With planning and precautions, the risk can be greatly reduced. Without a diagnosis, the potential consequences include death. Diagnosing DM1 can also save the life of a parent who is undiagnosed and unaware of their condition. DM1 is genetic, so at least one parent will have it too. Recognizing the child's symptoms can allow them to get diagnosed and take the necessary precautions to lessen their risk for sudden death. Early diagnosis from a PT or PTA can mean not only improving the individual's daily living, but also saving lives. Myotonic dystrophy is the #1 type of muscular dystrophy in adults and is underdiagnosed. Once diagnosed, we can set appropriate goals and our help as PTs and PTAs be so much more effective. By recognizing signs and symptoms, you can help get the diagnostic process started. As with any diagnosis, it's the people with myotonic dystrophy and their families that are important. They wanted you to know these things. DM1 can make it hard to do everyday tasks, to move around, or to have enough energy to do more than one thing in a row. DM1 can make it so you can do something one day but not the next. DM1 can result in physical pain. DM1 can create GI issues that can be painful, limiting, or embarrassing. DM1 can create cardiac and pulmonary issues that people don't even know about, sometimes until it's too late. DM1 is genetic, so the family part is about way more than being a caregiver. DM1 has no cure. DM1 can be very confusing if you have it and don't understand why these things are happening. The right diagnosis does wonders for that understanding, and we can help. It's important to recognize that DM1 gets worse over a lifetime and gets worse from generation to generation. DM1 has hallmark signs but shows great variability both within a person and between affected people. Now that we know more about how to recognize DM1, we can dive deeper into the genetics of the condition. We will break it down simply. DM1 occurs due to an abnormal expansion of a certain section of DNA, showing as multiple repeats of the CTG gene. Anticipation is when each new generation has more repeats of this gene. The symptoms then occur earlier and are more severe in subsequent generations. This prompts the imperative need for early diagnosis. When it comes to DM1, we thought explaining genetics would be easiest with a visual. The blue DNA strand will represent the CTG gene that repeats in DM1 and determines the severity of the disease. As you can see, this gene is passed down from generation to generation, and more CTG repeats occur in each generation, resulting in more severe presentation of DM1. A parent may not notice any symptoms, but may still be at risk with cardiopulmonary effects. Children with more severe symptoms may get a diagnosis and allow this parent to receive life-saving care. When it comes to DNA repeats, we can use this chart to better understand the severity of symptoms. It's also important to note that the more repeats they have, the earlier the onset of symptoms as well. Individuals in Generation 2 may be asymptomatic or not show symptoms until as late as adulthood, but their children's DM1 will likely progress much faster and could have more severe symptoms. What do you do if you think you notice some symptoms? You should think myotonic dystrophy, then discuss with another clinician, not a patient at this time. Use this to-do list to help guide your course of action. Check for other symptoms. Talk to your patient about their experience. You're putting together pieces of the puzzle. PTAs. Talk to the patient's PT. Utilize your resources. If you think someone might have myotonic dystrophy, use this video and other good resources to solidify your thought process. You will know more than most healthcare providers. Be ready to share information about your patient and about DM1. You will likely need to educate your patient's primary care provider and honestly, even most neurologists. PTs. Report your concerns to the patient's PCP, along with other information about DM. They might not know about DM either. It's time to be your patient's advocate. You can help by going to myotonic.org. Here we will show you how to access useful resources from the Myotonic Dystrophy Foundation website. Step 1. Visit myotonic.org. Under Support and Care tab, click on Toolkits and Publications. You should arrive at a page with the following heading. Here you can find the screening for diagnosis criteria that we went over previously in this video. If your patient is diagnosed with DM1, you will also find important information to share with the cardiologist and their pulmonologist, even if they didn't see these specialists before their diagnosis. Hand grip myotonia and eyelid-ptosis are strange and annoying, but the heart and lung issues associated with DM1 can be deadly. You can also access guidelines further down this page that can be useful to PTs and PTAs. We hope this video has helped you to recognize some common signs and symptoms of DM1, to know where to find some great resources, and to understand the impact that your help can make. When you first meet a patient, your normal greeting may be enough to check for hand grip myotonia and bilateral eyelid ptosis. If you have a suspicion of myotonic dystrophy, we have no cure to offer today. A diagnosis of DM1 can, however, be a positive in that it can help your patient understand what is happening. This alone makes a huge difference. With the diagnosis, they can educate their doctors and mediate the cardiopulmonary risks for themselves and for their parent. They can also plan and prepare for what is to come, as DM1 typically progresses over time. They may be able to enroll in a clinical trial to help themselves or others with DM. You can help all of this happen without a 7-year wait. Yes, you have the power to help. DM1 is a rare disease that has a great impact on those living with the condition. The more we know about DM1, the more we can do for those individuals. Now it's your turn to make a difference. Listen for what perks up your memory and keep your eyes open for those clusters of symptoms. You have the ability to make a huge difference in myotonic dystrophy. We know that you can help. For more information, visit the sources provided. Contact PTs for myotonic at gmail.com for more information. Thank you for listening.